fact, let's now bring in Dr Mvuyisi Mzukwa, who is the chairperson of the South African Medical Association. Sir, thank you so much for your time. And of course, just moments ago, we heard that judgment then being delivered by Judge Mono Tefo. Just your comments and reaction as the South African Medical Association?
Well, thank you so much. And I must say that, first of all, good afternoon to you and to your viewers. And also thanks for inviting me. I think it's a very huge indictment on the democratic government. This government has shown to be very embarrassing when it comes to healthcare. And also their lack of listening skills. They can't listen to the voice of the profession. It is one of the lessons that they must learn from this, because before this incident, the South African Medical Association has been raising serious concerns about this whole debacle of moving patients. And we were ignored like they normally do. They normally ignore professionals. I think they are learning the hard way, and I hope this is going to teach politicians to remain in their lane when it comes to issues of governance and administration.
And I mean, it's taken a number of other, inquiries for us to even get to this moment. We saw the ombudsman getting involved. We also saw, of course, Judge Moseneke, who also held another inquiry in which he also was scathing in terms of, his findings, which resulted, in constitutional damages of 1 million rands to each, claimant. That's it back in 2018. But when you look at the timelines, it took the former MEC, Qedani Mahlangu, several years before she actually appeared, before an inquiry of this sort, to just state her case. And even during that particular time, she absolved herself, or she, stated that she had no direct impact as a result of what we are currently talking about today. Over 144 people, patients dying, in the most heinous of manners. I mean, just your comment on the conduct, of the health professionals that have been implicated, within this tragedy.
Well, I must say again that if you look at what is happening or what has happened there, you see the shielding of politicians by other politicians, but also how the law is very lenient when it comes to politicians. You must see some cases where, issues of a doctor would be carried in a yellow van. But with politicians, it's not the case. They are shielded. Like I said initially, it took so many years for the politicians to be dragged, into the courts or into this inquest. Otherwise, if it was according to their way, they were not going to come to even account. We've got a serious problem of political interference when it comes to management and the leadership of healthcare systems in the country. And it is also the tragedy of corruption, because if there was no tenders and all these things, we wouldn't have seen what we have seen now. So what we see now is what we've been always talking about, that let's separate these two. Let us allow administrators, technocrats to do their own work. And politicians, they must deal with policy and overseeing of the profession or the healthcare system. So what we've seen now is really a huge indictment and a huge embarrassment for this democratic government.
When you start to speak to the families, Dr. Mzukwa, in fact, even some civic organizations that were part and parcel of, making sure that we get to this point, some of them say that in the 8 years, during this process, they haven't seen the necessary changes within the health fraternity. particularly as it relates to, the psychiatric wards and how we handle, mental health patients in this regard. They haven't seen any movement in as far as, just even holding people accountable that should be held accountable, in those positions. I mean, you mentioned the fact of separating, technocrats from politicians, but we saw how Dr. Bani Silebano, the Gauteng Health Department head, also resigned. We saw how Makgabo Manamela, Director of Mental Health, also resigned, and she, like the former health MEC of Gauteng, has also now been implicated and should be held accountable. I mean, does it have to take more than 144 people to die before we see that political will, before we see movement and change within this fraternity?
Well, the huge problem that we are facing in this country is the issue of leadership and governance. There is a report now that has been issued out by the Academy of Science of South Africa, ASAF, that points out the serious challenges that we are facing in terms of leadership and governance. And it points out the role of politicians interfering with how the systems are run in the country. But you must recall that, whenever these technocrats are given instructions, it's not given on email, because there must not be any evidence. So they are just given by the word of mouth, so that when there are inquests like this, politicians can be able to absolve themselves. So we are saying to our colleagues, don't take instructions that are not written somewhere, to you, so that in the next time there is an issue, you are able to absolve yourself. But the greatest problem here is the issue of leadership and governance. And this, by the way, is not going to be only those 144 people. It has happened before when it comes to AIDS denialism. And again, the voice of the profession was ignored when we pointed out, the issue of ARVs being given to patients. The last thing is now what we are facing, the NHI. The voice of the profession is ignored again. And we are saying to government, if you are going to be implementing NHI on, this poor leadership and governance, it is bound to fail. You cannot implement such a huge policy when you do not have infrastructures in place, things like your leadership and governance in the healthcare system, and you are not capacitated. So that is where the challenge is. All these other problems are emanating from the challenge that we're having in terms of leadership and governance.
And just your comment around NGOs who are then, meant to look after people with very sensitive needs. I mean, what we saw in this tragedy is we saw over 1,000 patients with very unique, specifications and needs being moved to 27 or so ill-equipped NGOs. And within weeks, some patients started dying. That relationship and that synergy between NGOs and the health department, as an example.
Well, look, the issue here is not simple just people becoming just getting patients to those NGOs. It is a facilitated corruption that has led us to where we are now. So what we're saying is, if you want to get rid of this challenge that we're facing, we've got to cap down the issue of corruption. There's no way that you can take people to institutions that are not well equipped simply because you've got deals with them, and money's in your pockets. It happens to everyone. All these politicians, they need to account. Even with the health minister now, I hope he's not going to come with the previous approach of just going to the media and firing people in the media, not doing proper investigations. They must wake up now. They must smell the coffee. The people are dying on the ground. They need to take care of the populace in the country. We can't allow a situation where we have, ministers who are just running around in the media like headless chickens.